physical exercise as a means of intervening in dementia, specifically Alzheimer's disease, is something that has gained the interest of many within the recent years. That's largely been driven by two things. First of all, that studies in animal models of AD have provided quite convincing evidence that physical exercise may modify AD pathology. Secondly, several large epidemiological studies have shown that physical exercise, or being physically active, reduces the risk of cognitive decline, including dementia. So we were really interested in whether any of these findings with regards to AD pathology had been tested in human beings. We ourselves at our center have conducted a large randomized controls trial with patients with AD, where we looked at some of the AD pathology with biomarkers. So I did a systematic review of the literature with regards to any intervention studies of physical exercise and AD biomarkers. We looked at both healthy elderly subjects, patients with MCI, as well as AD patients, and we looked at MRI biomarkers, specifically hippocampal volume, biomarkers in CSF, T-tau, P-tau, and A-beta, and we looked at FDG PET imaging and amyloid imaging. And we identified a total of 7 studies, 6 of which were in healthy subjects, where the outcome measure was MRI measures, specifically of hippocampal volume, and 1 study was of CSF biomarkers in patients with AD. And we were not able to conclude whether or not physical exercise is able to modify any of these biomarkers, simply because studies were relatively small and of varying quality, and a lot of them were also not significant. They didn't show any significant results.